Hello. Welcome to my channel. In this video we will talk about the heartburn during pregnant. What is heartburn for pregnant? When does a heartburn start for a pregnant woman? The heartburn for a pregnant woman. The danger of heartburn for pregnant women. The main symptom of heartburn for pregnant women. The most important reasons of heartburn during pregnancy. How to get rid of heartburn when pregnant. What is the treatment for heartburn for a pregnant woman? Heartburn during pregnant. Pregnancy is an important thing for the continuation and survival of life, and it is a very nice feeling, but the most important effects and unwanted diseases that a pregnant mother is exposed to during her pregnancy must be known, and the most important of these symptoms and diseases are heartburn and stomach acidity for the pregnant woman. When does a heartburn start for a pregnant woman? Pregnancy heartburn is one of the most common pregnancy problems. Pregnant heartburn usually occurs in the second and third trimesters of pregnancy, and although it does not indicate a serious illness, heartburn may be the cause of pain and discomfort for pregnant women. Indigestion is commonly known as indigestion or an upset stomach. The heartburn for a pregnant woman. Heartburn can be best described as a painful sensation in the throat and chest that may extend across the back, arms and jaw. Heartburn is a disease that not only affects pregnant women. It affects anyone, but pregnant women are more likely to suffer from heartburn, and the reason for this is hormones. Recent studies and research have shown that 17% to 45% of pregnant women develop these symptoms from time to time. Heartburn, also called acid indigestion, can last between 30 to 60 minutes. Usually, the pain of heartburn increases when you are lying down. Therefore, the pain caused by heartburn can generally be relieved by standing up and staying upright, taking antacids and swallowing water and saliva, which are among the most important antacids in heartburn. The danger of heartburn for pregnant women. If you experience frequent and abnormal heartburn and heartburn, this may indicate the presence of a more serious condition known as gastroesophageal reflux disease. Gastroesophageal reflux can lead to severe heartburn and other serious diseases such as esophageal ulcers. Sometimes, heartburn is a symptom of heart ischemia. Therefore, a person must undergo a series of tests and analyses such as endoscopy, X-rays, esophageal motility test, and manometry. The main symptom of heartburn for pregnant women. Heartburn generally occurs when digested food containing acid goes up through the esophagus. Feeling a sour taste in the mouth is a normal feeling when a person or pregnant woman suffers from heartburn. This condition, known as regurgitation, is caused by bending over, straining, or lying down right after meals. Stomach acid may affect a person's respiratory system, which in turn may lead to hoarseness, sore throat, chronic cough, asthma and tooth damage. The most important reasons of heartburn during pregnancy. The cause of heartburn in pregnant women is that there are some foods that can cause heartburn when consumed in large and inappropriate quantities. These foods include chocolate, alcoholic beverages, highly caffeinated beverages, spicy foods, garlic, onions, and fatty foods. Peppermint, tea, coffee and alcohol also lead to heartburn and heartburn. Lying down right after eating can lead to heartburn and heartburn. Lying on the back allows the acid to flow through the esophagus, causing a painful stinging and burning sensation. Also, eating a large meal and eating too fast leads to heartburn. There are also certain foods and practices that irritate the lining of the esophagus and thus may lead to heartburn. These foods include citrus fruits, smoke, ibuprofen, aspirin, tomatoes, tomato sauce, and osteoporosis medications. Other foods that cause heartburn include black pepper, mayonnaise, creamy sauce, butter, margarine, salad dressings, and whole dairy products. People with certain serious conditions are more likely to have heartburn. These conditions include scleroderma, Crest syndrome, hiatal hernia, gastroparesis, diabetes and autoimmune diseases. Normally, food passes through the mouth and travels to the stomach. While a person is not eating, the valve in the lower part of the esophagus closes, creating a barrier between the stomach and esophagus. This barrier works to prevent acid from building up. But when a person eats, This valve opens, allowing liquid and food to pass through. Therefore, if the valve opens when a person is not eating, this allows the acid to pass up through the esophagus, causing a burning sensation in a pregnant woman. Heartburn during pregnancy. Heartburn is very common during pregnancy. This is usually caused by the increase in hormones that cause the muscles of the digestive system, including the valve, to relax. Lying down immediately after eating makes pregnant women more likely to have heartburn. When the muscular valve between the esophagus and stomach is relaxed, stomach acids tend to back up into the esophagus. Also, the increased size of the uterus may push stomach acid backward. Gallstones are also said to contribute to heartburn. How to get rid of heartburn when pregnant. Heartburn is not a dangerous condition, but it needs to be managed properly as it can cause a lot of discomfort to pregnant women. To reduce the burning sensation of a pregnant woman, this can be done by controlling eating small meals and avoiding large amounts of drinks and liquids during your meals. What is the treatment for heartburn for a pregnant woman? To treat heartburn in pregnant women, you should follow the following: weight control, do not lie down immediately after eating, and try to avoid fatty foods and spices. And when lying down, try to lift your head up. And avoid eating excessive and large amounts of food when bedtime approaches. In the case of heartburn, doctors often recommend weight loss. People who are overweight or obese are more likely to develop heartburn. Losing weight reduces pressure on the stomach, which in turn can reduce heartburn attacks later. Also, quitting smoking is also an effective way to manage acid indigestion. Smoking has the ability to irritate the digestive system in the body, which leads to aggravation of heartburn and gastroesophageal reflux. Pregnant heartburn treatment pills. Antacids usually contain calcium and magnesium, which may help relieve heartburn symptoms, but some antacids contain aspirin, aluminum and sodium, which may be harmful to the baby and the mother. Although over-the-counter medications may be helpful in combating heartburn symptoms, pregnant women should exercise extra caution when taking these medications as they may cause significant negative effects on the baby's health. Always ask your doctor before taking these medications. In the end, please activate the bell button, subscribe to the channel, to receive from us all that is new. For more information about pregnant heartburn, please visit my own site. You will find the website link in the description. Thank you.